fine with left lower quadrant pain. What at all in your abdomen can give you left lower quadrant pain? It's right here. A client presents to the emergency room with 3 days of left lower quadrant pain. 1, some nausea but no emesis. 2, report of chills. 3, bowel movement last night. Okay, some dysuria. So trying to avoid some pain. 4, and suprapubic tenderness as well. 5, anorexia. She does not want to eat. He or she does not want to eat. Oral intolerance due to pain. So cannot eat anything. At last colonoscopy 5 years ago. So you can think about it right here. What is the history? Hypertension, hyperlipidemia, the colonoscopy, no allergy, alert-oriented, febrile, slightly tachycardic, respiratory is okay. Exams, soft, non-distended, but tender to palpation in the left lower quadrant, and a Y count of 16,000. You have everything you needed. Have Y count infection, left lower quadrant, for 3 days, have fever, nausea. What do you think? This is diverticulitis, acute diverticulitis, inflammation of the diverticulum. And then you should be able to manage the patient. Making diagnosis from history, physical exams in past history is very, very relevant. So you got to develop that skills and look at the signs and symptoms. Then what? What do they want us? We know is what? Acute diverticulitis. What is the question? Which of the following is our expected priority action? Anybody with a GI symptoms should have what? IV fluid, MPO, antibiotic, pain management, sometimes NG tube, and whatever is indicated for that particular problem. So for this patient, I don't think she needs NG tube. She's not vomit. Antibiotic, yes. Clear liquid dye, no. You got to keep it MPO. MPO, yes. IV fluid, yes. CT scan, yeah. We got to look inside. So we need a CT scan to look inside. Appendicitis, you need CT scan. Gallbladder, you need ultrasound. So this one, CT scan. Colonoscopy, you don't want to put anything in the rectum when they have inflammation. So no enema, no colonoscopy. So this is wrong. So this is not expected. So this is what is expected. Antibiotic, MPO, IV fluid, CT scan. We don't need NGT, we don't need clear liquid dye, we don't need colonoscopy. So that's the first group of questions you should pay attention to. Then what happened? This is a series of questions. CT scan showed inflamed sigmoid consistent with sigmoid diverticulitis. Or you're saying that they have acute diverticulitis. However, patient pain migrated to left upper quadrant. So the pain was left lower quadrant. Now it's left upper quadrant. What do you think? Is it splenic rupture, bowel obstruction, abscess formation with potential bowel perforation, or fistula to the kidney? When somebody comes with diverticulitis, who do you see? And they have left lower quadrant pain, that is fine. But if the pain went to left upper quadrant, it's a priority action. So we got to see this patient. It means they develop an abscess or they're about to perforate. So this one is the right answer. Key fact, critical thinking. Then what happened? Third portion of it, you see these are series. The abscess was percutaneously drained, so we drained everything. Patient did well, did okay. At discharge, now going home. Which of the following statements need immediate intervention to prevent recurrent episode? So now they're going home, and we want to teach them things to do so that they don't come back again with diverticulitis. That's what he's saying. What do you teach? You want to teach them how to prevent diverticulosis malformation, and then that lead to diverticulitis. So the whole thing is fiber, hydration, and exercise. So drink 2 to 3 liters of water a day. You have to. If they give you 1 liter, 50 ml, no, it's not enough. 2 to 3 liters of water a day. Excellent. I will perform 30 minutes moderate exercise 3 times a day. Yes, that's exercise. I will stay on low residue diet. No, you need to be on high fiber diet. I will stay on low fat diet. No, you need to stay on high fiber diet. I will use fleet enema daily to that. No, you don't need to. We want you to go regular. So fiber, water, and exercise. So this is what um, they need to do. Therefore, these are the question is asking you, which one do you need immediate intervention? These three. The first two are okay. I'll drink 2 to 3 liters of water a day. I'll perform exercise. Yes, those are okay. Those that you need to intervene, stay on low fiber diet, wrong. Stay on low fat diet, wrong. Stay on use fleet enema, wrong. So 3 to 4 are your right answer. This is the end of it. As you can see, they can give you 5 questions in the series. This is the way they will do it for you, but you just have to follow the plan and the management.